Hello, today I'll be demonstrating how to do a sub-Q injection. First, I am going to read the doctor's orders. Doctor's orders is to do uh, 10 units of regular insulin for this patient who has diabetes. So I'm going to compare it to the MAR. It does make sense. The patient does have diabetes. So I'm going to go gather my medication and my supplies. I have my regular insulin, and it's not expired. It is non. I can see the liquid in there still looks really normal, really clear. This one I'm just going to pretend has never been used, and I have my syringe here, and I'm also going to have alcohol pads. Alcohol swabs. So I am going to draw 10. I'm going to draw 10 units of insulin. First, I'm just going to draw 10 units of air. Remove the cap, and we are going to put that air in there, and then I am going to draw 10 units of regular insulin right there, and I'm going to have a second nurse verify what I drew, and I'm going to use the scoop method to put the cap back on, and I'm going to have this vial with me so that I can scan it at the patient's bedside as well. Nurse verifies it, and it is 10 units. I probably can't see it, so I'm going to go over to the patient's room and bring medication and get this administered. So come in. Hello. My name is Eddie, and I'll be your nurse this morning. And can you tell me your name and date of birth at this point in time? I'm looking at his wristband, and he's giving me name, last name, and date of birth. That's 2 identifiers. I'm going to give privacy, and the reason why I'm here is I'm here because I have your insulin today. Are you familiar with that? Do you have any questions? Okay, and I'm giving you 10 units today. And so, do you have a preferred site for your insulin, your abdomen? Okay, it says here it was given to you in the left upper quadrant, so I'm just going to do it on the lower right quadrant. Okay, so we are going to prepare. I've already washed my hands. Gloving up, and I'm gonna glove up. Here's my insulin. I already checked it. I scanned the bottle, and I'm the ampule, and I'm doing 10 mLs. And before I do, I'm gonna go ahead and clean the site, and I'll start in the center, working my way out, putting good friction, making sure I clean the area very well. Okay, and now I'm going to tell the patient they're going to feel a pinch, so I'm going to pinch the skin. I am going to insert. This patient has pretty good adipose tissue. I'm going to go in at 90 degrees. Injecting, and as I pull the needle out, I'm releasing the skin. I'm also going to use the scoop method again. At this point in time, I wouldn't use the scoop method. I would actually put my needle in my sharps container. If I see any bleeding or anything here. I would add pressure. This is sub-Q. Most of the time there's not a lot of bleeding. So I would just put pressure until the bleeding stops. Do you have any questions? No? Well, I'm going to go ahead and put his bed back in a comfortable and safe position. Give him the call light. Be sure to call me if you need anything. Remove my gloves and do hand hygiene. And then I am going to go document.